like to talk a bit about what moxa is, or moxibustion. I'm going to use one today that looks like this. It actually comes in many different forms. All it is a herb called mugwort, and this is a herb that is dried and then it's crumbled, the dried leaves. Imagine like dried autumn leaves that are crumbled and kind of compacted together, and it's shaped into this shape that looks like a cigar. I'm typically going to use it on patients for pain, especially if there is a cold component to the pain. So for example, frozen shoulder, or even golfers or tennis elbow, and very much for knees and sometimes for lower back. If there's a cold component, that means typically that type of patient will tell us that their pain is actually worse when it's cold. I'm sure you know that person who tells you they always know when the weather is going to change, or when it's going to rain, or when it's going to snow, because whenever it does, their knees start hurting. Well, that gives you a very good idea that that person suffers from cold, stagnation in that knee joint, so cold is making it worse. Because all that pain is your own blood and oxygen that's stuck in an area. So what does cold do? Cold congeals. It slows blood down even more, so really it makes pain worse. Sometimes we'll use this for fertility, and actually, to be honest, I think I use it more for fertility than for anything else. Because if I have a patient who has a uterus that we think may have a cold component inside the uterus, then we will use the moxibustion to heat up the uterus. And typically how cold will get into the uterus will often happen after a C-section, because in the process of having a C-section, that uterus and that abdomen is being opened to the environment, and typically inside our hospital room, it's very cold, and air conditioning can literally go inside the uterus and make it cold. What's lovely about this is it allows us to get pinpoint, almost accuracy, in a particular location. I can actually use this moxibustion and hold it on that area, and the heat will penetrate really deeply into that point, and then it'll actually spread through the entire joint. So I want to show you what it looks like, because we actually would need to light it first, and it does take a little bit of time to light. I don't think you can really see that it's lit, but it is lit. If I held it a little distance from my hand, I can actually feel that it's warm. And then if I actually do hold it on that point, I can feel this delicious heat go into the joint. And I'll hold it there until it feels warm, and then I'll hold it there until it feels hot. And then that's it. That's moxibustion in a nutshell.